Hi, it's Gary Chimes from Lake Washington Sports and Spine, and what I'd like to talk about today are the different types of tendon tears. I'm going to be using the rotator cuff, specifically the supraspinatus tendon, which is the most commonly injured rotator cuff tendon, as sort of the model, but this principle applies to other tendons in the shoulder, knee, hip. Just in general, it's discussing the different subtypes of tears. So the main subtypes of tears are either no tear at all, a partial thickness tear, a full thickness tear, a complete tear, and a retracted tear. So I'm going to try to show it in a couple different ways of visualizing to give some sense of understanding. What we're looking at here is an example of a cross-section of a healthy shoulder. So this would be the humerus or arm bone, and this would be the scapula or shoulder blade. And the supraspinatus tendon, it sits on top of the spine, thus the name supraspinatus, and it has these intact fibers that are going to be inserting onto this edge of the humerus at a place called the greater tuberosity. It has like a nice, beautiful bird's beak appearance. The fibers are nicely aligned, and that's what a healthy tendon looks like. If you can imagine a cross-section going through here, I've divided the tendon into 9 components. You know, it's not actually 9, but just to give a visualization. And we can see is that there's healthy tissue in each of those sections. The next type of tear is something called a partial thickness tear. I'm going to try to demonstrate that on a paper towel. If you imagine the paper towel sitting like this, so there's 3 layers in this plane, and then there's also layers as you go parallel, and in a partial thickness tear, you're tearing part way through a layer, but the layers above and below are fine, and the side from adjacent and parallel planes are fine. So this would be a partial thickness tear. So what we see in this case, this would be called an intrasubstance tear. There's other types of partial thickness tears. It could be on the upper side, which is called a bursal side tear, or it could be close to the bone called a cortical side bone. But the point being is it's not torn all the way through, and the structural integrity of these can be pretty high. So one of the important points is that most partial thickness tears can be rehabilitated through pretty easily. Sometimes these tears are bigger than other ones, but it's not torn all the way through. That would be called a high-grade partial thickness tear. So that's a partial tear. And what this is trying to show is in the cross-section, you have this part here that is torn, but the other fibers, both in parallel and both above and below, are intact. The next class of tear is going to be a full or a complete tear. And if you were looking at that on a paper towel, if I take this piece of paper towel and take where that hole was, if instead of being torn partway through, it's torn all the way through. So you can see I can like stick a finger through it, but you have parallel fibers that's intact. That's a full thickness tear. And again, the structural integrity of that can actually be pretty strong, versus a complete tear is where it's torn in all planes. So if you're looking through only one cross section, you can't tell whether you're looking at a full or a complete tear. The distinction is a complete tear is torn all the way through in all planes, whereas a full thickness tear is torn all the way through, but only in one plane. And the difference there is going to be structural integrity. As a rule of thumb, full thickness tears are ones that sometimes need surgery, but can often respond well to rehabilitation, whereas most complete tears are going to need surgical intervention to deal with them, although there are some exceptions. And then there's a special type of complete tear, which is called a retracted tear. And the distinction between that is, again, let me take a new paper towel, and I'll kind of go through those steps of progression again. So you have a partial tear that's torn partway through. You have a full thickness tear that's torn all the way through in one plane, but other fibers are intact, so it's doing good. This would be a complete tear. It's torn all the way through, but the fibers are touching each other. And then there's a retracted tear where they're pulled apart. And retracted tears are going to be ones where it's important to do surgery, because unless you can get those fibers touching one another, then it's going to be having an absence of potential for healing. One of the things I do want to emphasize is, again, that partial tears and full tears, these are things that can often be rehabilitated. And really the critical element is, do you have some intact fibers for which a matrix can attach? And the way I often think about that is, if you think about like the old rock candy, where you have a container that contains super saturated sugar, and then you stick a rope into it, and then you pull it upward, it forms a matrix of crystals from the sugar around that tendon. And the same thing can happen here. is that this space where the tear sits, you can have connective tissue come into that area, initially as scar tissue, and then over time that can remodel. So partial tears and full tears have potential to healing as long as you have at least some intact fibers in place. So this is Gary Chimes, Lake Washington Sports and Spine.